Yes, it is.
And I'm Hawaii born, so I'm very excited to talk to you.
Are you really?
I am, yeah.
Oh,
What island are you on?
I'm on Oahu.
Yep, that's where I was born, Kapiolani, baby.
Are you serious?
Yeah.
Wow. Wow, that's great. Were you a military?
My dad was a physician for the VA, so close.
Yeah, okay. So he worked at like Tripler.
Yep, VA. Well, he was in private practice on, oh gosh, I'm forgetting the street. For a long time, we lived in Hawaii Kai. And before that, Wailaiki. And yeah, just taking care of the vets. He was a prostate cancer specialist. He used to fly to Maui on Tuesdays for surgeries, Big Island or Kauai Thursdays, sometimes to Guam. So yeah, military
Wow.
for sure. Yeah.
Wow, yeah, that's super cool. Well, be glad you're not here right now because we're kind of,
It's so hard. I know my heart's been going out to Hawaii right now. I know it's been really, really tricky for the economy, for travel, for people's livelihood. So my heart goes out to them.
Well, we just came out of our second stay home order. Another month of staying home, and oh gosh, it's been a challenge, And I mean, for us, we like to travel, and because we come from Hawaii, and of course I am an at-home travel agent, and well, okay, face it, I haven't booked anything.
Right.
I mean, how can I? I mean, it's been hard. So, I mean, this time of year, normally we're in Europe because I have a daughter who lives in Europe.
Oh,
and yeah, so we actually had plans to be there. We spend 2 weeks with my daughter, and then we do a 2-week cruise home.
Fun.
Yeah, well, that's not happening this year.
Yeah.
We can't even get there. So it's kind of a bummer because I haven't seen my grandkids in Italy in a year now.
They must be military. Are they military?
Yeah, my son-in-law's in the Army. So, it's nice, but honestly, and this is a pressing question I had wanted to ask is, I mean, knowing where we're from, we have to go through just getting to Europe or anywhere in the world because we're like in the middle of nowhere. And we have to take a plane. We have no choice. And we have to actually, I mean, unless we're going to Vegas, there's really no straight flight to wherever we want to go. So, I mean, how would you deal with that? Because that's what makes me nervous is I'd love to go when I can, but how safe is it for me to get on 2, possibly 3 flights between Honolulu to, let's say, Venice?
Yeah, so, of course, minimize the connection. So, maybe it is finding a 1-stop rather than a 2-stop flight. And, of course, it's hard right now because, obviously so many flights have been canceled, but, they are now slowly starting to come back. I really hope, I know that some airlines have actually been adding flights to Hawaii because, some of the transatlantic flights are being axed. And I know that there's, new service that's being started from Newark to, I think they're launching a new nonstop to Maui, and they're launching some other Hawaiian routes. So the one map that has actually been enhanced during this time are the Hawaii flights. So I think that'll hopefully allow people to take a 1-stop connection. If you're in Maui, you can now go Maui nonstop to Newark, and from Newark, pretty much anywhere in Europe. So, I think the other thing that we're finding is, obviously in Hawaii, unless you're doing like an inner island, you can't take the quickie getaway. You do want 1 or 2 weeks. But I think, number one, not planning too far in advance. So with Hotwire, I know we have found that people will save more money when they book last minute. The flights are actually a lot less full. A lot of planes are going to be on a plane that's 75% empty, which also means some better airfares right now. And I think from a health point of view, one statistician looked at some of the data. I think this was about a month old. So this article came out sometime, I think, in August. But he looked at all the data and he found that the chances of contracting COVID on a plane were, if the middle seat was open, 1 in or approximately 7,000, or if there's somebody sitting next to you, 1 in 4,000. And when I read that analysis of the data, I thought to myself, wow, that's a lot lower than I thought. So we do
Mm-hmm.
think that a lot of the transmission is coming from what we know, indoor spaces. So some of the cases, when people were traveling, it was probably the gate area, not social distancing, not wearing masks. I think one of the things that really surprised me is just how clean airplanes actually are. You
Yeah.
know, they're kind
Mm-hmm.
of, you know, the tray tables are kind of like, you know, if they're an older plane, they kind of look kind of crummy sometimes. But I think it was really surprising to know that they have these HEPA filters that can help to filter out the virus. Now they have these enhanced cleaning methods that are helping these airlines to really be hopefully cleaner than they've ever been. I don't know about you, but some of those like Hawaii flights, when you're stuck on that plane for 10 hours, you're like, man, this plane is dirty. So I think
Yeah.
the benefit is that all of the airlines have announced that their older fleets, you know, some of these old, you know, obviously the 747s that I used to fly on with my family from Honolulu to Chicago nonstop, and you know, and then connecting to see my grandparents in Ohio. Some of those older birds are being retired, so you're also going to get a lot more newer Dreamliners. I know there are those Japan flights to Honolulu on the 380 still.
Oh
Um,
yeah.
so
Yeah.
you're going to
I
get a
love the 380s.
Oh, me too. It's such a fantastic bird, isn't it? So you're just going to get maybe an enhanced experience, a cleaner experience. You're not going to, you know, you might hit the lottery and get the free upgrade to business and coach because you can lie down if you happen to not have two
Well,
people next to you. So
you
hopefully
know,
you're going to get that free upgrade.
well, I don't know. They're not that easy to come by, but we flew just before this pandemic started back
Yeah.
in end of February,
Mhm.
and we were in Dubai, and we were on a 380. Getting there was no problem because I flew because there's a lot of Emirates flights, and so what I like you said, I minimized my connections. So I
Yeah.
flew Honolulu, Houston, then Houston into Dubai, which was great.
Yeah.
But coming and it was great coming going because we got to choose the good seats and we because I've always traveled where I don't like anybody near me.
Yeah.
That's just always been me without the pandemic, right? So, but coming
Same.
home, the plane was full and people
Mhm.
were coughing and I ended up on a seat because I didn't have a choice next to these two men that were coughing up a storm. And I'm like totally freaked. I mean, who wouldn't be at that point? Because you're hearing news about the coronavirus and I'm just trying to get home. So I asked
Yeah.
them to move me. There was not a single seat to move to. And it was a 16-hour flight.
Oh,
I
wow.
was like having a fit. Finally, my husband looked at her and said, "Hey, you got any seats in business?" And she was like, "We'll check." They had two. So we ended up paying for the upgrade and it cost us a lot. I'm not even gonna tell, not even gonna lie. But it was one of the greatest 16-hour flights that I've ever had on it. I mean, airline business class was awesome.
Yeah.
But and the most important thing is neither of us got sick, you know, because I mean, when you're sitting, literally sitting elbow to elbow with somebody who, two people that next to you coughing, I mean, what are your chances? I mean, I doubt they had coronavirus because I didn't get it, but still, would I have gotten sick, do you, in a situation like that, you think?
Well, you know, I think what I tell people is not to confuse the possible with the probable. So, you know, it's hard to know, you know, there's so many variables, right? So, did these people actually have coronavirus? A lot of people have the common cold when they're traveling. You know, your immune system is down, so you get a little bit of a cough, the air is drier. There are a lot of different reasons, and COVID is probably it's not the most likely reason that somebody is going to be coughing. Of course, I think there's a hypervigilance and all of us are thinking of that. So what I like to focus on are what are the things that we can control. So, you know, if you are at that plane seat and somebody, you know, whether or not somebody is coughing, you know, take that air nozzle and have the nozzle like sort of near your face, but sort of pointing away from you so that if there are particles that they're going to be blown away. You know, you can wear your mask. Hopefully they're wearing their mask as well. And I think the most important tip that I have is all about the research right now. So doing, you know, as you do, you know, planning that trip and finding the part of the plane that nobody is sitting in, or now is a great time to burn those miles for those upgrades to ensure that you're getting a business class flight. You can do a little research. I know that when I use my miles for upgrades, I want to be on the best plane, and some of the airlines that I fly now have doors in business class, so you can actually have a little pod. And I know that Hawaii
Yeah.
tends to have those great wide body planes with really fantastic business and first class seats. So I think it's all about not being scared, being more prepared, doing your research. And again, some of the stats that have come out, it's a lot less likely than I would have thought. I think people are more likely to contract COVID in indoor public places before you get on the plane, like the gate area, if you're crowding, than you are on the plane itself. So I think just common sense, doing all of the things that we know work: mask wearing, hand washing,
Hmm.
sanitizing, all of that stuff. And the other great news, I saw one airline is installing hand sanitizer stations in their planes that are going to stay probably forever. And so I think that some of the changes are going to be great ones when all of this is said and done.
I hope so,
Me
because we
too.
love to travel. I mean, I'm ready to go.
Yeah, this has probably brought island fever to a whole new level for a lot of Hawaii residents, for sure.
Well, you remember too, when we come home, we face a 2-week quarantine.
Right, right.
So that adds like an extra level of trying to figure out how to travel.
Yeah, well, and I've also read that Hawaiian is adding drive-through. I know that just in a couple of weeks, I live in LA now, and for I think the fee, don't quote me, but I think it's $75 before, or if you want to pay for the rapid. So you go to the airport. Hawaiian Airlines has set up a rapid COVID test and the same day expedited is 150. So you just go to the airport,
Hmm.
allow an extra 30 minutes, take the COVID test, get on the plane. So I hope that Hawaiians and people going to Hawaii are going to have that extra layer of safety. I know other airlines are now following in Hawaiian's lead in doing that. So it's about being more, again, just more prepared than scared. And for me, I've been taking a lot of quickie getaways using Hotwire. I know the governor of Hawaii and the government there are probably looking at setting up these guidelines, and maybe it is about taking a quickie getaway over to another island right now if you are able, and just doing what you can, especially when you have kids in Europe and things like that, like a lot of family in Hawaii do have.
Yeah, yeah. Well, thank you. I think that's actually really good advice. Instead of being like totally tense and nervous for 16 hours.
Yeah, yeah.
Thank you. Well,
Thank
you
you
have
for
a good
having me.
weekend. I'll talk,
You too.
nice talking to you. Thank you.
You too. Thank you.
Bye bye.